Welcome to Tsene with Well Life Inc., your mental health and wellness hub. I think in the past 2 videos in the month of June and also in the introduction video to the winter warmers, which is our July theme, I have been talking about the transition that we're going through. Yes, you're going to be still seeing a lot of purple around us with the green that we are transitioning into. So in me holding this mug is just to remind you that we're still the same. It's Pretoria Psychologist, it's just that Pretoria Psychologist has grown, and in it growing, it has acquired a name, which is Well Life Inc. And with that said, I want to speak today, as we talk about the winter warmers, about postnatal depression or postpartum depression. It is used interchangeably most of the time, but there is a distinct difference in that the postpartum depression is about the parent and the postnatal depression is about the child. I was actually surprised when I did research around the topic. Yes, I speak about it and I counsel people on it, where people come in to therapy suffering from postnatal depression. But I was surprised to know that statistically 1 in 5 women do develop postnatal depression, and also 1 in 10 fathers do develop postnatal or postpartum. So I'm going to use postpartum and postnatal interchangeably, even though I have already explained what is the difference. This is also known as your baby blues. So yes, a person can say that the mother who just gave birth or the father who just became a parent has got baby blues, but the scientific name is postpartum or postnatal depression. With that said, is that it can range from the mild symptoms to the paralysis or the severe paralysis depression, where a person is unable to feed themselves, unable to feed the child, unable to get up, unable to socialize. So basically, they do not have any sense of being productive in their own lives. The onset, we say anytime between after the child has been born up to 12 months. So anything after 12 months of the child being born is no longer postpartum or postnatal depression. We can obviously, if the symptoms of depression are there, we will then mark it as depression, depending also on the other excluding factors, such as maybe a person going through grief or a person going through a traumatic experience. So that is what marks or what identifies that. You may ask yourself, what causes postnatal depression? And the causes, they range from social to emotional to physical. So in terms of the physical, it will be more about a person not having support or even in themselves, because remember, when a individual becomes pregnant, their hormones, they change, and sometimes the person does not know and cannot catch up with the changes that have happened to their body. It can also be as a result of somebody who has had a history of mental health issues such as depression. That's mostly what also is a marker, where then you find that because they already have a history, they are more prone or they are more susceptible to being depressed postnatally, especially where they also do not have enough support and where there is no intervention. The difference in relationships, so maybe when a mother that has a difference with the father of the child, or the father of the child has got a difference with the mother of the child, that can also be a trigger to triggering the postpartum depression in both the mother and the father. Because as you remember, I mentioned that 1 in 10 men do develop postpartum or postnatal depression. Limited support as well. This is when we talk about the social, and as I said, also the physical, the hormonal changes, and then with the social, then it's limited support. So the person does not know where to go. They are overwhelmed with this responsibility, and they know that this responsibility responsibilities for a lifetime. It's not like back to sender. You cannot have a child temporarily, or you can't have a child so that you can have a temporary happiness, which is something that I can talk about later on, where people conceive to fill in the void or to feel happy, but then they do not have a good way of thinking. Why do they want to conceive, or why do they want to have a child? So the symptoms can be low self-esteem. It can range from feeling inadequate and the feelings of guilt. So the feelings of guilt comes from not being able to attend to the child, because remember, you yourself do not have the resources to deal with the situation. You are emotionally detached. You might even feel guilty about not loving your child. You might feel guilty about not being able to bond with your child. So those guilt feelings that come from the things that you are supposed to do and that you are unable to do. Inadequacies in, am I good enough as a parent? Maybe I'm not doing the right thing. Maybe I'm not cut out for this. I thought I wanted this so much. I remember this other lady, it was a while ago, she was a colleague, and she said to me, I fell into postnatal depression because I wanted to give birth naturally, so have a vaginal birth, but instead I had a cesarean section as a result of my body being unable to accommodate the cervix. The cervix could not accommodate the child to go through the birth canal. So those who know, a child, a baby in utero, they drop at a certain weeks, and that is how also the obstetricians or the gynecologist is able to see if you are ready to then give birth. And so she had this thing, and she said to me, Nkateko, I felt like my body had betrayed me, because she had expected that because she is fit and her, physique is a particular way, her body is supposed to be able to give birth naturally. And as I said, because of feeling inadequate, therefore she fell into a postnatal depression. Tearfulness, difficulty sleeping, panic attacks or anxiety, and also low sex drive can be markers of postnatal depression. So sometimes maybe you might be thinking, why am I having difficulties in bonding with the child? Why am I not happy that I've got a child? Maybe it was a long time that you were trying to fall pregnant, or that you were planning to fall pregnant. Maybe you have done things a certain way and you have set up your life in that, you felt that you were ready, but only to find that you feel this kind of emotions. And that is to say that all of that is normal, and maybe you can look back and see that was a sign of postnatal depression. The inability to cope as well with yourself and with the circumstances, because it is a huge change. It's a lifestyle change. It's an adjustment. You need to change so many things. Maybe you are overwhelmed by work, by demands of people, neighbors, friends, and whatever role that you play around the society. And then you might be asking, now, how do we deal with this? How do we overcome this? Just like with depression, obviously intervention is very important, especially in the range that I've spoken about. Remember, I spoke about the mild way in which you can experience postnatal depression or postpartum depression, and also there is a severe way in which you feel paralyzed and you are in a severe form of a depressive episode. Firstly, be patient with yourself. You are not you cannot snap out of it. You cannot just start loving your child or will yourself to loving your child. So sometimes you might even feel like it's difficult for you to just breastfeed, because that breastfeeding means you are connecting with the child, where you are releasing the oxytocin, which is a bonding hormone. And obviously, the only way the lactation or the lactating hormones can be released is through also the bonding hormone. So be patient with yourself. This is normal given the diagnosis. So you need to then take it one day as it comes. Accept the circumstances that you are in. Limit, situations that demand very much of you. So meaning that you need to surround yourself with people that are actually going to offer you help. Do not, because remember, you're already feeling guilty and inadequate about being a parent. Do not overstretch yourself. If you need to use the services of a babysitter or a nanny or a relative or a cousin or even your partner, if they are not experiencing the same thing, use that. Go away. Have your time alone. Go to the shops. I had this client who also suffers postnatal depression. And what we did was, instead of us having the online, because she frequently had an online session with me because of the young child, and instead of having the online, I said, you know what, for our sessions, you dress up, leave the child with the nanny, and come to the practice. And then after having been at the practice, go to the shops, go and have coffee, go and have adult conversations with other adults. So in that, taking care of yourself, that is very, very important. And also stay connected and make sure that you've got the emotional support that you need. If you feel that the postnatal depression or postpartum depression that you are having is severe enough to disable you from doing anything, from waking up, that you are forever sad, you are even thinking negative thoughts about being a mother or a father, or negative thoughts towards your child, like harming the child, do reach out for help. There is psychiatric help, there is psychological help, there is support that is out there, and I encourage you to enlist those services as soon as possible, because the help is out there, and this is also treatable, so that you are able to cope much better. This is the Skaftin for this July month in the theme of winter warmers. I'm hoping that this is information that can be helpful to you who are suffering this, or you are suspecting that maybe this might be it, or a friend or a neighbor or a colleague, that you can be able to refer them to good sources that can be useful to them. Myself, Nkateko Ndalamahoro, signing out. I will see you in the next episode.